Okay guys, mabuhay, maligayang pagbabalik sa aking YouTube channel. Actually, update lang ito, latest nga ito sa Instagram post or update ni Kris Aquino para sa kanyang sitwasyon and sitwasyon na rin ng kanyang anak na si Joss and of course ni Bimbi. But anyways, medyo maraming medical terms so medyo mahirapan akong ikwento or sabihin sa inyo. But eto muna yung sinabi niya sa kanyang message kasi mamaya may mga art card pa siya na ginawa na kailangan ko ring basahin sa inyo. Medyo mahaba-haba nga yun, guys. So, eto na nga. Sabi ni Kris Aquino, I chose not to share with you until now that Beam had fever starting on Saturday night, July 8. It started as a bad cough and sore throat. Monday, July 10, Dr. Henry, our Phil-Am friend who thankfully has been so kind to me and my sons, came by to check on Beam. I felt my heart crumble because Beam, from Dr. Henry's assessment, had pneumonia, third time na for Beam. The second bout with pneumonia happened during the initial pandemic lockdown when we were in Puerto Galera, March 2020. My bunso has had asthma since he was 9, but as a baby, all the way until he was in grade 1, Beam suffered from skin asthma, and from childhood till now, he has many of my environmental allergies. It was the worst feeling in the world, as most parents would agree, when your family doctor says you aren't allowed to go near your son and help take care of him because you're undergoing immunosuppressant therapy using chemotherapy medication. Okay? Thank God, Beam's Kuya Josh stubbornly refused to leave the connecting room where Beam had to stay. He was Beam's constant companion, and even though my nurses kept telling Kuya to stop hugging Beam, tuloy pa rin siya. Thank God matibay Kuya's resistance, hindi siya nahawa ng kahit ubo o sipon. Talagang, syempre, yung kapatid talaga, na hindi mo basta-basta iiwan yung kapatid mo. Limuel is both a nurse and phlebotomist. His business to do home service blood extraction. He did my blood extraction Tuesday, July 12. Been finished his prescription Saturday and is 90% recovered. My lead doctor from UCLA, Dr. John Belperio, had my results Wednesday, and he has the best, most positive outlook even when he's giving bad news. I will try to explain my current situation without using too many medical terms. There'll be in art cards along with some pics to help you understand where I am health-wise and what a long battle I have. One thing is very clear to me, buhay ako ngayon dahil hindi kayo nagsasawang isama ako sa prayers niyo, even though most of you have never even met me in person, and that's why I owe you only the truth. So, eto nga yung mga nakalagay sa art card, yung katulad yung nakikita nyo, no? So, medyo may, tingnan natin na kung kakayanin ko pa ito. So, ayan, the biological injection used on me did its job, and I think Dr. Malika Gupta, the allergens in my blood have gone down, and my total allergen count, my IgE has never reached this low level. Mataas pa rin compared to a normal healthy person, but for someone coming from the thousands to finally be below 500 is something to be grateful for. But iba yung side effects on me. Your one, it's common to get a cold and cough or a bad headache, but I react very unpredictably to medication 2 to 3 hours after my shot. My BP gets elevated after 6 to 8 hours. I start to feel deep bone pain which lasts for the next 3 to 4 days. I'm not complaining, at least I have access to medication that can help save my organs because Church-Strauss EGPA is a rare and aggressive form of vasculitis. With treatment, there's a 70% survival rate after 5 years, but with no treatment, after diagnosis, the survival rate goes down to less than 25%. Yun. Some of you may wonder bakit hindi siya uminom ng pain reliever. Unfortunately, I'm allergic to paracetamol, ibuprofen, aspirin, mefenamic acid, etoxib to simplify all NSAIDs. Steroids, the first line of defense for autoimmune patients, have an adverse effect on me. For others, it helps reduce their hives and swelling. I did a steroid challenge back in the Philippines on May 5, 6, 2022. 5 doctors watched over me as 80 mg of hydrocortisone was slowly infused via IV into me from 9:30 p.m. to after midnight. 2 a.m. rashes appeared from head to foot. 3 a.m. I was crying because any little movement I made caused me tremendous pain. I can now admit I needed sedation by my anesthesiologist because the pain was unreal by the time I was cognizant. On Wednesday evening, we had a new president. That's how difficult it is for doctors to treat me as a patient. Most most feel I've been here for more than a year and yet nothing has really happened. When we arrived, I had three diagnosed autoimmune conditions: autoimmune thyroiditis, chronic spontaneous urticaria, and Church syndrome, now called EGPA. During the time we had COVID in Houston, my blood test, this was when more than 30 vials of blood was extracted for me, revealed I had the fourth autoimmune condition, Kris syndrome, which is the milder form of or starting point of systemic sclerosis, systemic scleroderma. Please pray with me that I don't progress beyond Kris syndrome because systemic scleroderma most often can cause damage to the lungs, either because of pulmonary hypertension, the heart does so much work for the blood from the lungs to reach the heart, or a pulmonary embolism. Ayan, Diyos ko, ang hirap, di ba? Dr. Belpera couldn't outright make a diagnosis before because my ANA count had already reached the confirmatory level for LSE or lupus. I said hindi ata alam ng mga ANA count ko na postponed yung best of concert tour of Madonna kaya nag-over the borderline pa rin. But at least nag-joke pa rin si Kris. But I was also exhibiting signs of rheumatoid arthritis, SLERA, and scleroderma. All manifest very similar symptoms, so it's hard to distinguish. It's also my bad that I have researched too much. So when I saw how bad my RBC count was, how low my hemoglobin had reached, and all other physical manifestations, I knew I could already put a check mark on practically all the symptoms of SLE. I had to accept that what had always been a possibility is now reality. My repeat blood test will be this Thursday, July 20. So my next cycle for my biological injectable will be on Monday, July 24. The blood panel will determine if my dosage will be brought higher on July 25. We'll know if my methotrexate dosage also be raised. The dosage I'm on right now causes me to be so exhausted, feeling like I have the flu and struggling to get out of bed. I can only imagine how much harder it will become. That's also the start of when I will have limited contact outside. That's the explanation why it has taken us so long to find a home to list because of my medical needs. Ganun kahaba yun. So